autistic and apparently breathing's not supposed to hurt when you run, which is honestly kind of rude because I just always thought that running should make your lungs feel spicy. So I went to the pneumologist today because I had some more symptoms while running, like actually tasting blood in my mouth and my airways closing up like it was exercise-induced asthma, right? And I talked to her about the fact that like running always hurts, but this is like more of a hurt. And she was kind of confused and asked some more questions. And then she asked, so how long has this been going on for? And I looked her dead in the eye and I said, well, always. Like it's the most normal thing to tell someone, oh, exercising just makes me feel like I want to actually die. Because normal people do say that. And it makes sense to you that, oh, so it's not nice and that's how it feels. It just hurts. She asked me why I never saw a doctor about it. And this is where autistic perception sets in. Because obviously to me it was normal. But turns out autistic normal is not normal. It's the baseline. If it always has been like that to you and people have been telling you, oh, that's normal, it's your normal. You're not asking yourself, is this pain? Is this exercise? Is this my soul wanting to leave my body? Or is it asthma? When people keep telling you it's normal. My lung x-ray and my resting lung function were perfectly fine. They were great. My allergy test though, my immune system reacted. It had like personal beef with someone. The lesson with all of this really is just because something feels normal to you, it's not always normal. Sometimes for autistic people, normal is just an untreated symptom with seniority. So yeah, it turns out people are usually run without wheezing, pain, and tasting coins. That's really strange.
Did you know that asthma has different stages? Asthma is classified into different stages based on the frequency and severity of symptoms, as well as lung function measurements. Intermittent asthma. Symptoms occur less than twice a week, including nighttime symptoms. Mild, persistent asthma. Symptoms occur more than twice a week, but not daily, with nighttime symptoms occurring 3 to 4 times a month. Moderate, persistent asthma. Symptoms occur daily, with nighttime symptoms happening more than once a week, but not nightly. Severe, persistent asthma. Symptoms occur throughout the day, with nighttime symptoms happening often nightly. These classifications help healthcare providers determine the best treatment plan, which may include a combination of long-term control medications and quick relief, rescue medications to manage symptoms and prevent exacerbations. Regular monitoring and adjustment of the treatment plan are essential to managing asthma effectively.
What's wrong? I can't breathe. I'll get a teacher.
What's up?
Dale can't breathe.
Go to the office and ask them to call an ambulance.
Fun fact about me, I have asthma. This morning I woke up and taking in a full breath really hurt the top of my chest. I kind of freaked out a little bit. I have rehearsal all day today and I had the show and we're going into a 5-show weekend. I started to panic a little bit. The thing that sucks about panicking a little bit is that asthma and anxiety, I put hot water on my face, did my inhaler right away in the morning. I came here, I also have a nebulizer, which is like this little kitty thing. I did a steam before the show, but I truly don't believe a year ago I could have gone through this day without having a lot of anxiety or calling out of the show. I'm really proud of myself because I felt very capable and locked in to my technique. This is my 3rd Broadway show, and I've been doing this show for almost 2 years now, and I'm only just now feeling like on the days that I'm 60%, I still am able to show up and do my job. So the times that you're angry at yourself for something that you didn't get right away, stop being so hard on yourself.
Asthma. Asthma is your body's way of overreacting to a trigger known as an allergen, or exercise, cold air, pollution, respiratory infections, and stress. If you were to suffer from this, your allergen could be anything from flower pollen to dust. You could be walking down a street lined with blossoming trees on a sunny spring day. The gentle breeze carries clouds of pollen your way. At first, you might just feel a slight tickle in your throat or some mild coughing as your body recognizes this harmless allergen. But for someone with asthma, it triggers an excessive inflammatory response. Your lungs' airways, which are normally relaxed and open for easy breathing, begin to overreact. The muscle bands around the bronchial tubes constrict, narrowing the airwaves. Simultaneously, excessive mucus starts building up, further obstructing the constricted passages. You begin gasping and find it increasingly difficult to catch your breath. As the asthma attack progresses, your chest feels tight, like a heavy weight is pressing on it. Each inhalation requires intense effort, but fails to pull in enough oxygen. You start coughing uncontrollably, trying to expel the mucus and open your airways, but to no avail. Panic sets in as your breathing becomes shallower and more complex. In a severe asthma attack, your bloodstream can lack the proper oxygen to supply vital organs. Left untreated, you might turn pale or blue from from inadequate oxygen, experiencing dizziness, or even lose consciousness.
Different types of asthma explained, aka reasons your lungs be acting brand new. Allergic asthma. Your lungs got beef with pollen for no reason. Like, why are we fighting air? Exercise-induced asthma. Start running and your lungs are like, oh, so we doing cardio today? Yeah. No. Cold-induced asthma. Step outside in winter and your lungs instantly go into airplane mode. Stress anxiety. Asthma. You're already overthinking and your lungs are like, let me add a little spice to that panic. Occupational asthma. Your job is literally your villain origin story. Clock in, can't breathe, clock out. Nocturnal asthma. Big asthma waits until 3 a.m. because apparently it's a night owl too. Non-allergic asthma. Nothing specific triggers it. Your lungs just wake up and choose chaos. Severe asthma. Regular asthma but on crash out time. No warnings, just vibes and suffering. Childhood asthma. Being a kid and your lungs said, you thought recess was fun? Think again. Adult onset asthma. You made it to adulthood and your lungs said, surprise, new DLC unlocked. Now you know. So what type of asthma do you have?
Silent asthma, symptoms, causes, and treatment. What is a silent asthma? Silent asthma, also known as symptom-free asthma, is a type of asthma that doesn't cause obvious symptoms. People with silent asthma may not experience wheezing, coughing, or shortness of breath, but they still have inflammation and narrowing of the airways that can lead to serious health problems if left to. And treated. Symptoms of silent asthma: tightness in the chest, difficulty breathing, feeling tired, difficulty sleeping, short of breath during exercise. Causes of silent asthma. The causes of silent asthma are the same as those of other types of asthma. It is caused by inflammation and narrowing of the airways, which can be triggered by a variety of factors, including allergens such as pollen, dust mites, and pet dander, exercise, cold air, respiratory infections, stress. Treatment for silent asthma. The treatment for silent asthma typically involves the use of inhaled corticosteroids to reduce inflammation in the airways, as well as bronchodilators to help open up the airways and make breathing easier.
You're okay? Do you have an inhaler? No, but it's fine. I'm okay. Until you're not.
Mijo, ¿tiene problem?
The problem is your son has asthma and no medication. He needs an inhaler.
We don't have insurance. Can't afford it.
I volunteer with a group. Anything happens, call this number. We help, no question.
Thank you for coming so fast.
Where is he?
I would have called 911, but he said it was like breathing through a straw. And now he can't talk.
Hey, Tomas. I'm Michelle. Do you remember me from the other day?
Crazy. Lady?
Yeah. Let's get you up. Okay. I need you to take 2 puffs of this and breathe real deep, okay? Okay, let's get you down. Listen to me. I need you to hold your son completely still no matter how uncomfortable he gets. Do you understand? I'm gonna intubate him.
Please save him.
Let me get your head.
Okay.
Here we go. Okay. Come on.
Vamos, mijo. Respira, respira, respira.
Come on.
Gracias a Dios. Gracias.
This is for you.
Yeah.
Don't lose it.
Okay.
You can get him some over-the-counter allergy meds to help with the congestion. The albuterol is for the attacks. It should last a few months, so if you need more, you can call me.
Thank you.
I'm having an asthma attack. Can I buy inhalers?
Do you have a prescription?
No, but I'm having an asthma attack.
Sorry, sir. We can't help you without a prescription. Next customer.
Here are 5 things you didn't know about childhood asthma that could save a life. First, a child is rushed to the hospital for asthma every 3 minutes in America. Most of these attacks happen because of triggers hiding in plain sight at school and home. Second, 40% of severe asthma attacks are caused by strong cleaning products used in classrooms during school hours. Those fresh-smelling floors and desks are actually dangerous for kids with breathing problems. Third, rescue inhalers become completely useless after sitting in hot cars or backpacks for too long. Even if they look fine, they need replacing every few months, whether used or not. Fourth, untreated asthma attacks don't just hurt in the moment. They cause permanent lung scarring that reduces athletic ability for the rest of a child's life. Fifth, teaching kids to use a spacer device with their inhaler increases medication effectiveness by 90%. Proper technique matters more than having multiple medications available. One simple plastic tube can be the difference between life and death.